Hello, I'm Dr. Grace Prescott. Let's be honest, do you often take a hot, relaxing shower at the end of the day to relieve stress and sleep better? That ritual, which feels like the safest and most comforting moment of your day, might actually be a silent trap. What if I told you that the way you shower could be drastically increasing your risk of having a stroke during the night without any warning signs? In this video, I'm going to reveal 5 extremely common shower habits, especially for those over 50, that traditional medicine rarely talks about. We're not discussing obvious factors like cholesterol or smoking, but simple mistakes related to water temperature, shower timing, and even the steam you breathe, which can create the perfect conditions for a catastrophe while you sleep. By sticking with me until the end, you'll learn to identify these hidden dangers and, more importantly, discover how to make simple, immediate adjustments to protect your brain. This knowledge isn't just informative, it's a prevention tool that could literally save your life or the life of someone you love. Ready to dive in? In my over 10 years treating patients who've suffered a stroke, what worries me most aren't the well-known cases of people with a history of hypertension or severe heart disease. What keeps me up at night are the stories of seemingly healthy, active individuals who followed all the medical recommendations and, out of nowhere, had their lives turned upside down by a sudden stroke. The shocking truth is that in many of these cases, the trigger was something as mundane and daily as a shower, and very few people know this. Neither doctors, nor family members, nor even hospital discharge reports typically mention it. There are shower habits that silently set the stage for a stroke, and these incidents aren't rare. They happen every day in thousands of homes. Let me tell you about Arthur. At 72, Arthur was a meticulous retired accountant when it came to his health. But he had one daily pleasure, a scalding hot shower before bed. He said it was the only thing that relieved his joint stiffness. One winter night, his wife heard him collapse in the bedroom. Arthur was on the floor, confused, with the left side of his face paralyzed. He had suffered a stroke. The culprit? His beloved hot shower. And that brings us to our first dangerous habit, taking very hot showers, especially before bed. I know it's tempting. A hot shower feels like it melts the day's stress away. But here's the problem, especially for those over 50. When the water exceeds 104 degrees Fahrenheit, 40 degrees Celsius, your blood vessels dilate rapidly. Think of them as balloons inflating suddenly. This vasodilation causes a sharp drop in your blood pressure. In a young body with flexible arteries, this might only cause slight dizziness. But in arteries that have lost some elasticity with age, this pressure drop is a shock. Your heart has to work much harder to pump blood, and the flow to your brain can decrease dangerously. This momentary lack of oxygen is the first step toward disaster. The second dangerous habit is showering immediately after a heavy meal or after taking certain medications. It seems like a logical routine, right? You finish dinner, maybe take your blood pressure medication, and head straight to the shower. But this sequence can create a perfect storm in your body. After a big meal, your body diverts a significant amount of blood to the digestive system. At the same time, if you take a hot shower, your body sends more blood to the skin to cool itself. What happens? Your brain gets third priority, receiving a reduced supply of blood and oxygen. Now add medications like antihypertensives, which are designed to lower blood pressure. The combination of digestion, heat-induced vasodilation, and the medication's effect can cause such a severe drop in pressure that the risk of forming a blood clot multiplies. The golden rule is simple. Wait at least an hour, ideally 90 minutes, after eating or taking medication before showering. Give your body time to stabilize. Your brain will thank you. Now let's move to the third habit, which might be the most surprising because it happens in nearly every bathroom. I'm talking about long showers in small, unventilated bathrooms. You close the door to create that spa-like atmosphere, your own personal sauna. The steam envelops you, relaxing your muscles. It feels wonderful, but it's a trap. That dense steam is actually depleting the oxygen in the air you breathe. Meanwhile, the heat continues to dilate your blood vessels and lower your pressure. You're essentially creating an environment of hypoxia, low oxygen, right when your brain needs it most. Oxygen-poor air makes your blood thicker and slower, the perfect setup for clot formation. I remember a patient, David, a 71-year-old mechanic who spent nearly half an hour in a hot shower to ease his work-related aches. One morning, his wife heard a thud. He was collapsed on the bathroom floor, lips blue. In the hospital, we confirmed multiple mini-strokes. That oxygen-deprived environment, combined with the pressure drop, was deadly for his brain. The solution? Keep showers under 10 minutes and always ensure ventilation. Open a window, use an exhaust fan, but never trap yourself in a cloud of steam. The fourth dangerous habit goes in the opposite direction, suddenly exposing yourself to cold water. Cold therapy is trendy. Influencers and even some experts tout its benefits for waking up and boosting energy. For a young body, it can be invigorating, but for a cardiovascular system over 60, it can be a death sentence. The shock of cold water causes immediate, violent vasoconstriction. Your blood vessels constrict sharply, spiking your blood pressure to dangerous levels in seconds. In arteries already stiffened by age or cholesterol plaques, this pressure surge can cause micro tears. And how does your body repair these tears? By forming clots that can dislodge and travel straight to your brain. If you enjoy the sensation of cold water, approach it carefully. Never jump in all at once. Start with lukewarm water and gradually lower the temperature. Let your body adapt. Sudden changes are the enemy of a mature circulatory system. Finally, the fifth and perhaps most insidious habit of all, showering very late at night just before bed. This is the most dangerous because its consequences happen while you sleep, when you're most vulnerable and unable to call for help. Millions do this as a relaxing ritual, but biologically it's a conflict. At night, your biological clock, your circadian rhythm, works to lower your body temperature to prepare for sleep. A hot shower does the opposite. It raises your internal temperature. This confuses and stresses your cardiovascular system. Your body then struggles during sleep to cool down, often through sweating, which leads to nighttime dehydration. Remember Dorothy's story. Her nightly shower, which she thought was relaxing, actually dehydrated her body and thickened her blood. During the night, when blood pressure naturally dips, this combination created the perfect environment for a clot to form, causing a stroke that left her with permanent impairments. The lesson is clear. If you need a nighttime shower, take it at least 2 hours before bed. Give your body time to stabilize its temperature and pressure before the most vulnerable part of your day, sleep. I know this information might feel unsettling, but my goal isn't to scare you. It's to empower you with knowledge. Aging isn't a disease, but it changes the rules for our bodies. Respecting these new limits is the key to a long, healthy, and independent life. Let's recap the golden rules for safe showering after 50. First, keep showers under 10 minutes. Second, use warm water, never extremely hot or cold. Third, always ensure good bathroom ventilation. Fourth, wait at least an hour after meals or medications before showering. And fifth, if you shower at night, do it earlier, giving your body time to rebalance before sleep. And don't forget to stay well hydrated afterward. Small tweaks to seemingly harmless habits can be the difference between waking up to a new day or not waking up at all. Life can change in an instant. Words can be stolen, independence lost in a single night. But with awareness and care, we can turn a hidden risk into a safe